Hi, I'm Christina Bausch. I'm a physical therapist here at Rebound Physical Therapy in Topeka, Kansas, and I specialize in pelvic floor therapy. So today I wanted to talk a little bit about how pelvic floor therapy could help men who are experiencing either urinary or bowel issues and or pelvic pain. So when we think about pelvic floor, a lot of times we think of it as more of a female issue. So today what I wanted to do was just bring some awareness that men, yes, actually do have pelvic floors too, and they may be responsible for some of the bowel and bladder or pelvic pain symptoms that men are experiencing. So to talk about what the pelvic floor is, so if you imagine down in the bottom of the pelvis, there is a bowl of muscles, so kind of that underside of the pelvis is an actual bowl of muscles that is there to help support the pelvis and support the pelvic organs. And those muscles should be able to relax and contract. So when we think about where those muscles should be, just if you're sitting there at rest, if you kind of compared it to my arm muscle, when my muscles relaxed and just hanging there, it's pretty relaxed. That's where those muscles should be when you're just sitting, laying, not really doing anything. When you get up and move around, or you're trying to stop the flow of urine or stop from passing gas or bowel movement, when you're not ready for that to happen, those muscles should contract to provide more support. And then when you when you're ready and you're wanting to either empty your bladder or bowels, then we want those muscles to actually go from that normal relax to they should then shut off even more and relax even more. So we just want those muscles to be able to do the right thing at the right time. So some of the most common symptoms that I'm seeing in my male patients that I am working with are they may be experiencing either difficulty emptying their bladder, they may be having a lot of urinary frequency, having to go to the bathroom very frequently, like less than every hour, or waking up a lot of times at night to go to the bathroom. And that may be due to overactivity of the bladder, or it may be related to the bladder not emptying fully when they go to the bathroom each time. So both of those are things that we can work on to help retrain the bladder and the muscles to help improve how often they're having to go to the bathroom. As far as urinary symptoms, also a lot of times I'll see men who may be experiencing incontinence. That's really common, especially after maybe a prostate surgery or radiation. So that's something that we can definitely help work on. And then as far as bowel symptoms, we can help with constipation. Maybe they might be experiencing bowel urgency symptoms or even incontinence. And then pain is another area that we work on a lot. So that may be presenting as pain in the pelvis, it may be pain in the abdominal area, it may be tailbone, it may be pain in the genital area. So those are all things that may be related to some dysfunction in the muscles of that bowl of muscles in the pelvic floor or the surrounding trunk muscles as well. So things that we can do to help in physical therapy, we are going to just kind of look at the big picture. How's everything functioning? We're going to look at how well are you even able to find those muscles and be able to get them to contract or relax to do what you're trying to get them to do. We also look a lot at your breathing diaphragm muscle. Really that whole trunk and core all works together. So we're going to make sure that you're able to coordinate your breathing correctly with your pelvic floor, and then carrying that over to, are you using those correctly as you do day-to-day things throughout the day. If it's more of a bladder urgency type symptoms, we're going to do a lot of things to help teach you how to get some feedback back to your actual bladder wall muscle, so that it's not giving you that overactivity and making you feel like you have to go all the time. And then if there's pain involved, or sometimes even if there's not pain, there may be some tension or restrictions in the muscle, or there may be scar tissue if there have been surgeries or things. So we can work on manual techniques to help calm down those muscles, get them to be at a normal resting state, and maybe instead of being overactive and contributing to some pain. So that's just some ideas of things that could possibly help. So I hope that that's given you a little bit of awareness that men have pelvic floors as well as women, and they could be responsible for a lot of bladder, bowel, or pain symptoms that you may be experiencing. So if you are having these symptoms, first of all, it's a good idea to talk to your doctor and make sure that there's not a medical reason or something going on that we need to address first. But if they've kind of ruled out, anything from the medical side, definitely physical therapy would be a good next step to see what's going on with those muscles, and we can put together a plan to help you get over the symptoms that you're experiencing and help you have a better quality of life. Thanks.